pretty neat. Hello, this is Dr. Robert Bouvier, and you're here today to talk about the first step in 8-step pattern to learn about diabetes and diabetic control. Today's an appropriate day to start this because we've got Oscar here that just found out today that he's diabetic. Specifically, his hemoglobin A1C is 7.2, his insulin level is 25.36, that's fasting. Both those are elevated. In fact, normal A1C is 5.7 or less, he's 7.2. But his blood sugar was only 125 fasting. So we're going to find out what his 2 hour after lunch and dinner and stuff is. We're going to give him a diabetic thing, but we're going to go through the first step and how do we do the first step in finding out about diabetes. Now with Oscar, what happens with most people is that you tell them they have diabetes and it's kind of like, okay, I shut down, I'm not going any further, I need to be convinced of this thing, right? And so we're going to go through a process of helping Oscar understand about the diabetes, how to take control of it, so he can have a normal lifespan, live a normal life. And you know, one thing about Oscar is he already exercises. He already follows a pretty good diet. However, he does have a family history of diabetes in your family?
Not totally. No.
Not totally. So really doesn't have a family history of diabetes. So this is kind of the first step. Number one, you get to the diagnosis. And the diagnosis of diabetes is pretty simple. 126 or above in the fasting blood sugar, or a A1C that is consistent at 6.3 or above. And that varies depending if you're talking about the American Diabetic Association or the American endocrinologists. Some of the homeopathic people look at things a little bit differently. In fact, I've got Dr. Andrew Weil teed up here. I use his videos quite a bit to help people understand. And so getting to the diagnosis, making sure that we're going on the right path and that people understand that they have this diagnosis and that they're going to live normally if they do the right thing. He's not overweight. He exercises every day, so he's already got that down pretty pat. We're just going to tidy that up a little bit and get some specific aerobic exercise and change his diet accordingly. For him, he'll probably be totally diet controlled. In fact, today, we're not going to start any medication on him. Many times we would, if his blood sugar was above 170, fasting, I'd probably start him on glucophage or one of the other medications. So for him, we're not going to start any medication because I really think changing his diet, he's going to be able to totally get back. He might even get back to normal. So we'll see. We'll kind of track this. True life adventure with Oscar. Okay. So I want him to understand one thing, Oscar. I want you to understand what low glycemic index and low glycemic load is. And after we're done with this video, I'm going to take you over to this video of Dr. Andrew Weil. It's a 2-minute video, and he's got a bunch of other videos. In fact, he's got 25 videos kind of in succession that talk about the inflammatory diet and the perfect diabetic diet. Okay. And you're going to go home, you're going to look at those 25 videos. Okay, and I'll give you the link to that here in a bit. So I want you to understand low glycemic index, but more specifically, I want you to understand the idea of low glycemic load. Say low glycemic load.
Low glycemic load? Low
glycemic load. I know that it's like, what's that mean? Yeah. You're going to find out. It's part of your homework, okay? So I'm going to give you a blood sugar checker as well. And it's a blood sugar thing that that will help you. You'll prick your finger. We'll show you how to use it before you leave. I'll let you borrow mine until you can get one yourself. Okay. And you'll check your blood sugar. Fasting meaning you haven't eaten anything for 8 hours, but you can have water and you can have coffee, but nothing with calories. Okay. And you'll check that fasting, but you also check it sometime during the day and before at night. And we'll also maybe check it in the middle of the night between 1 and 4, just to kind of get an idea of what's going on in the middle of the night. Okay. There's 2 things I want you to check. You want to do the videos with Dr. Andrew Weil, and then secondly, I want you to go to the grocery store, any grocery store you go to the diabetic section, and I want you to buy one food item that has a label on it. Bring it back here. Don't eat it yet. Okay. Okay, don't eat it, but it's a diabetic food, okay, that you like. Okay. And we're going to learn about reading the label. Okay. But you go buy it, you go find out where your local grocery store is and where you get it. Okay, that's step 1. We're going to do this. This is step 1 of 8 for True Life Adventure for Oscar. And again, this is Dr. Robert Bouvier with Michigan Integrative Healthcare. Have a great day.